My name is Monique Springer. I'm the project officer with UWIHARP, and we are hosting this S-File discussion series. It's going to take place on Fridays, 2:30 to 4 o'clock in this room until the 29th of November, and you'll see the other topics that we have remaining. Just a couple of housekeeping before we get into today's talk. If you can please put your phones on silent. If you can hold your questions until the end of the presentation. And there's a parking lot for questions if you don't feel comfortable asking questions openly. You can write them on a piece of paper. You put them in the parking lot and I'll read them on your behalf. So there's a parking lot. Also, you should be given an evaluation form. If you can complete those and turn them in, you can either put it on the table at the front before you go. Even if you have to leave early, we'd appreciate it. There's also a sign-up sheet at the front on the clipboard if you want to get direct emails about our outreach projects and other events. I'm really glad to see so many of you. And I'm really excited, really excited about today's talk. I know I say that every week, but I'm genuinely excited about today's talk. So I'll just give you a little of an intro of UWIHARP because I've been seeing some new faces. We are the university's HIV program on campus. But at the university, there's one on each campus, but we have here at Cave Hill broadened into larger sexual and reproductive health topics. And you'll see a bit about what we do, What we also try how we see ourselves is positively influencing the sexual and reproductive health and wellness of our university population, which includes staff and students, as well as the wider society. And our primary focus then is to develop the sexual health literacy among our community here at the university. And we do this through interdisciplinary research and sexual health, capacity building, and sexual reproductive health and rights advocacy. And we achieve this through different means. Firstly, we support UWIs and HIV and STI counseling in the student clinic. Hopefully all of you are aware of this. This is done free of cost, and it's done through the Ministry of Health and Wellness. And it's free of cost to all registered students, should I say, all registered students. The schedule should be around, it's 3 days? It's 3 days this semester. We also offer free condom distribution through our office. For both these events, of course, you need to be 16 years or older. Yes. We also do interactive outreach activities on a range of sexual reproductive health and rights topics, as well as teaching and training programs in HIV and sexual health, advocacy, leadership, and professional skills. We also participate in sexual health, policy-oriented academic research. All right, so our S-Files sexual health discussion creates a safe space to discuss a range of sexual health topics. And we try to do this using positive language because we found in the field of HIV especially, the language around sex and sexuality became problematic and in some cases very demonic. So we try to have a space to have sex-positive conversations, of course couched in respectful, responsible behaviors. A couple of rules that we have for our S-Files discussion, and we have a little poster that we made over there on the wall for the rules. You may hear a range of rules, of views that you may disagree with. Please be respectful of others' views, although they may differ from yours. We cannot guarantee confidentiality in a group. Be cautious about what personal information you disclose about yourself and others. It's always safer to talk in general terms. Additionally, anyone in the group could be homosexual or have had a pregnancy termination, abortion, miscarriage, or experienced infertility. Please be conscious in the way we discuss these sensitive topics, regardless of religious or moral beliefs, taking care to talk in ways that do not discriminate or alienate others. Be mindful of UWIHARP's guiding principle, first do no harm, and please note that no photography or filming is permitted. We will be doing it for documentary purposes. We will turn off the filming during question and answer. I also want to thank EMS for coming out and doing this and supporting us. Okay, so our schedule for the semester, will have 8 over the semester, and 8, 7, and we have had menopause, cervical health, uterine fibroids. Today's on genital birth options. Next week we'll look at how to medically prevent HIV transmission through pre and post exposure prophylaxis, and that's a treatment regime. And we have street-based sexual harassment, which we will be commemorating the start of 16 days of activism that looks against gender-based violence. So we will be looking at street-based sexual harassment with Hollaback, which is a grassroots civil society organization that really speaks out against street-based harassment. And we have a focal point here in Barbados. It's a movement out of the US. There are chapters in Bahamas and Trinidad, and we're looking at possibilities of having one here, maybe a student-led organization. She is a student, and this activity will very much be student-led, and we encourage everybody to participate in that. And then the last one will be looking at vaginal or yoni steaming. We're looking at the ancient healing practices, myths, and risks and benefits, and then to debunk any kind of folklore. So today's topic looks at genital childbirth options, as I said, creating empowering birth experiences. And our objectives is to look at the evolution of midwifery and the practice of doula. And maybe Andrea will talk about what those are, and highlight the rewards and challenges of midwives and doulas, and identify potential opportunities in the 21st century. As a UWIHARP, a human rights, sexual rights organization, I must say we have a bit of a trigger warning. We will focus primarily on cisgender women, where gender identity corresponds with sex at birth. In other words, you were born with female genitalia and you identify as woman. I also acknowledge there are other groups of people that have anatomically female bodies but do not identify as women. These include trans men and gender non-conforming people who may experience childbirth as well. And just a note to say where you can find us. You can join us on the UWI app in groups and clubs. We're all the way at the end. If you want to access our flyers or see what events we have coming, as well as you can find us on Facebook and Instagram, and we're located in Charlotte Hall of Residence. Okay, I'm going to introduce now Andrea Bonita, pretty Jordan. She is an independent community midwife, breastfeeding specialist, childbirth educator, and birth activist. Her introduction to midwifery came at a young age when she was first interested in child development and felt her passion grow for looking after and learning about new babies. Her passion deepened with her understanding of the work of her late mother and godmothers, who were all midwives and best friends, working together at the Royal Berkshire Hospital, UK. Andrea grew excited about pursuing the profession of midwifery and studying at King's College, University of London. Helped seal the high standard of education and care that Andrea carries forward today. Andrea has worked as a group practice midwife, working as a part of a team of 6, providing one-to-one care to women in the community of Southeast London. Andrea has also traveled to Southeast Asia and worked as a volunteer, training midwives and health workers in Indonesia. And for the last 13 years, Andrea has been living and working in Barbados at a birthing center, home, water birth, and community midwife. During her time in Barbados, Andrea has had 2 children, both born gently outside of hospital. The first was a water birth at a birthing center, and the second, a water birth at home. The joy and empowerment that came with the birth of her 2 children has emboldened Andrea to make sure that this kind of experience and opportunity to choose this is available to all families in Barbados if they so desire. Awareness and advocacy about having an empowered birth through birth activism in the charitable organization Better Birthing in BIM, co-founded in 2014, and actually providing this as a service is for Andrea both an honor and a privilege. And I'm now going to ask Andrea to join me at the podium, and if we can show our support. Thank you.
So good afternoon, everyone. How are you all? Hot? It's a bit warm in here. Can you understand my accent? Because I've been told I'm very English. I sound very English. Okay, so as Monique introduced, I am a midwife and breastfeeding specialist, and I have a charity called Better Birthing in BIM. So I'll be talking to you about midwives, doulas, and empowered, gentle birthing options, and actually we're going to talk quite a lot about respectful maternity care, because this is something that I've noticed in Barbados and actually worldwide. It's a huge topic, how women are treated, how they experience their birth, and what we can do to make things better. Okay, so to start, I have, this is my lovely colleague and member of Better Birthing in BIM, Alison, just coming to join us. That's fine. So just to start, I know I have a very young audience in here, mainly. So I expect to probably get different answers from you than a different age group of an audience. But I wanted to ask a couple of questions first, just to see where you are and everything and what I'm going to be talking about. So firstly, I want a show of hands, if possible. How many of you have given birth or been with somebody during their time of giving birth? Given birth and being with someone during their time, so that's 1. Pardon? Being with somebody. Okay, so that's 1, 2, 3, 4. 4 of you. Okay. Thank you for that. I wanted to ask also, do you believe that labor and birth is supposed to be hard, painful, and traumatic? That's all of you. That's not just the ones who've actually given birth. Do you feel that labor is supposed to be hard, painful, and traumatic? Mm-hmm. Right. Okay. But birth in general, because we have a kind of a general consensus throughout society. We have a view of the way we look at birth and expect birth to be. Did you have any idea generally? Have you ever heard women, birthing persons, talk about birth positively, saying it was awesome, saying it was really empowering, saying it was fantastic? Any of you ever heard of women speaking about birth that way? You have? Wonderful. Who was that? Somebody on YouTube? Okay. So no one necessarily in your circle. Okay. Anyone else? When they're having dinner. Yeah. That meal that I had last night. Okay. It was an invasion. That's a really relevant question. Thank you for asking that. Okay. So you can guess from the questions where I'm going with this. So looking at what is a midwife, what is a doula, and how do they support gentle birth. Can I remove this? No, don't worry. Also looking at what is respectful maternity care. which is what I mentioned before, a very important focus for us as Better Birthing in BIM and on the international stage. Why is respectful maternity care important? And for those of you who want to have children and will be going on to create a family, you will be glad that you heard what we're going to discuss today in terms of your decision making, okay? What you decide to do for your birthing experiences when you decide to have a family. Okay, the background and history or herstory behind respectful maternity care. Looking at collaboration of international agencies and some of the things that the changes that have been brought about because of the collaboration that has occurred to bring about a better experience for families when they're having a baby. And then a little bit about the charity, our background. And then we'll look at the categories of disrespect and abuse in childbirth, because it's important that it's categorized so that we can understand what it really is. And then we're going to have some real life scenarios to look at, to discuss, and to categorize. And then we'll come to a close, okay? So, what is a midwife? So all of you are quite familiar with what a midwife is? You've heard of the word midwife. Good. And you're quite familiar with what it is, what that person is, or what that person does. It's a very old profession. So the word midwife actually means with woman. It's an Anglo-Saxon term, with woman, and that's exactly what midwives are supposed to do. Midwives are supposed to be with woman, not necessarily with hospital, with doctor, with protocols, with rules and regulations, but with woman, because it's a woman birthing person who is going to be experiencing and giving birth to this baby. A person, usually female, we have male midwives around the world, but there are probably over 80–90% female midwives, trained to assist women in pregnancy, labor, after the birth, during the birth, after the birth, and the postnatal period. So the midwife actually does clinical things. She's, catching the baby, she's doing blood pressure, she's checking urine, she's stitching up if she needs to stitch up, she's resuscitating if she has to resuscitate. Ancient midwives from way back when often offered care at the time of death and birth. So have any of you ever heard of a term called the witching hour? The witching hour. It basically refers to a time in the day when babies are more likely to come and people are more likely to transition, to pass away. And so it's generally between like 1, 2 in the morning and kind of 6 in the morning, around that time. And as you may know, they used to burn witches at the stake, right? In European times, burn witches. Witches were classified as witches because they basically did a lot of healing work in the community. They were involved in the family, in the community, in the village, in terms of birthing, and when somebody was passing away. So because they did a lot of work in that kind of time, that's where the word witch and witching hour came from. And why am I telling you this? I cannot remember why I'm telling you this. But right, ancient midwives offered care around. So nowadays, midwives, modern day midwives really focus in on the childbearing year. So maybe preconception time, a few months before the mother gets pregnant, the whole pregnancy, and then the first 6 weeks or so after, okay? Midwifery is an ancient profession, as I said. It is mentioned in the Bible many times. Modern day midwives have more of a focus on childbearing year, I said that, and midwives practice in many different settings. So wherever a woman is going to be giving birth is where a midwife will practice. If it's, a refugee tent, if it's on a boat, wherever it is, the midwife will be there to provide care. Studies show that midwife-led care, which is probably the optimum way of receiving care when you're pregnant, even though we don't quite have it that way necessarily in Barbados, a lot of women see the obstetrician, even in having a normal pregnancy. But midwife-led care, meaning that you see the midwife and you see an obstetrician if you're unwell, or if you're sick or you're high risk, midwife-led care is associated with very good outcomes. So lower cesarean section rates, less need for instruments to bring the baby out, less episiotomies. Anyone know what episiotomy is? Yeah, I got someone saying doing this. So cutting the vagina to expedite delivery. There's less need for analgesia, and there's increased vaginal birth, normal vaginal birth. So babies just come out vaginally more often when you have midwife-led care than when you're only seeing a doctor. And then breastfeeding rates and satisfaction rates are much higher as well. So, midwifery and seeing a midwife is a very positive thing to do. So just a little bit, I had mentioned the witching hour. There's an old text that I grabbed from the internet. Witches, midwives, and nurses. And really it just dates back to a time when the religious powers didn't really want women, nurses and midwives in a community using healing properties of herbs and things like that to bring health to the community. So they were targeted and named pretty much witches and gotten rid of as much as they could. Showing some images there of a midwife working probably in an African community. Again there. And then the Egyptian image, I wanted to show you that because, of course, in days gone by, women gave birth spontaneously. There wasn't any medicalization of birth. Birth has now been very medicalized. So we now have a situation where we have lots of cesareans. Women seem to need lots of help to give birth. In the image here, showing the Egyptian picture, that woman is squatting. She's supported by quite a few people around her. Women should never be alone giving birth, never. They should always be well supported. So you can see she has support behind her. She has two behind her, and they're all touching and supporting each other almost as well. And she's actually delivered twins. So there's one the midwife is helping to bring out, and there's another one in the arms of the third midwife behind. And to me, this image is wonderful because it just shows how kind of far away we've moved in the way we have medicalized the birth process. So doulas. Anyone know what a doula is besides reading it up there? Heard of a doula? Heard of doulas, great. I'm really glad to hear. No, I'm glad to hear that you're hearing about doulas though, because they're very important. It is, so a doula is a trained non-medical, usually woman, who assists a woman before, during, and after the childbirth process. So the difference between the doula and the midwife is that the doula really does a lot of support. She's a birth companion. She's there for the couple right the way through the process. She's very educated, very knowledgeable. She shares that knowledge with the couple so that they have very much reduced fear levels, and they're in a very positive space to have their baby, mentally, emotionally, physically, spiritually. And so they have very good outcomes with a doula. With a doula, you can reduce cesareans by up to 40%, apparently, what the research tells us. So doulas are making a huge comeback, which is wonderful. So the word doula is Greek for mother's helper. I think it actually means mother's servant, but they say mother's helper. The doula work is also ancient. As I said, women way back when, thousands of years ago, never gave birth alone. They always had somebody in the village who supported them through the birth process. But it's now become, it's made a resurgence, I suppose, in the last 25 years or so because of the way that birth has become so medicalized, and women have become, some women are petrified of giving birth now, whereas before that was not a word that accompanied birth, right? Doula work is a powerful women's advocacy tool because if you think about it, the doula is focusing on the mother and the couple, the family, and in a holistic way. So she's giving care that supports them mentally, emotionally, spiritually, physically. So as a women's advocacy tool, it's powerful. having doula support at birth reduces cesarean sections, I was saying. I mean, really, if I was Mia Motley, I would really be looking into having every woman have a doula at their birth, because if you're reducing cesarean section rates by that much, having a doula with you, that is a lot of money. That translates into a lot of money in maternity health care and the cost. So it's a powerful thing. So other positive benefits: reduced need for analgesia, so opioids like pethidine and morphine that may be given in labor, and epidurals. Reduced preterm births, which is powerful again, the amount of money that's spent for babies to enter NICU when they're born preterm. And improved experience of labor, less trauma. So we're going to move into the whole trauma thing in a minute. And I don't want to kind of make it too weighted on a trauma, but this is something that we do need to address. So how can midwives and doulas or birth workers support gentle birth? And this is really what the talk is supposed to be about: gentle birth, empowered birth. Birth has become increasingly medicalized, which is why I asked you earlier when we first started. I asked you if you had ever heard of women saying about their birth, oh, it was powerful, it was awesome, it was just wonderful. We hardly hear that. And there is a very kind of heavy, pervasive fear towards birth in our societies, and not just in Barbados, all around the world, unless the woman is living in a very traditional community. So birth has become more like a medical procedure than a normal physiological process, which is what it is, okay? Cesarean section rates have skyrocketed. In some countries, can you believe they have cesarean section rates at like 90%, 95%. So in places like Brazil, they have over 90% cesarean section rate. Private practice, public is more like 50 to 60%. But the fact is that we've now tipped over the edge of halfway. So we're not, most babies are born operatively in some countries, and that's a serious thing. Fear levels around birth are so high now that women are either opting, because they're so afraid of giving birth, they're either opting for operative delivery. They're saying, you know what, just give me a cesarean. I prefer not to. I've had lots of clients like that say to me, I don't think I can do the whole pushing a baby out thing, and I'd rather just have it, then I know what day and time, and I don't have all the pain, even though having major abdominal surgery is pretty painful. They would often rather opt for that. But many are turning towards reclaiming the old traditional ways, the ways our body was made to get a baby born. And this is accessible through holistic community midwives, which is how I work, doulas, and birthing centers. Mothers are reclaiming gentle, empowering births and demanding respect for maternity care. And the whole respect for maternity care is the main issue. So I want to ask you, when you look at that image, what comes to mind? You may have one or two words that come to mind when you look at that image. Just shout them out. Invasive. Too many people. Gloves, which means medical. Right, lovely. Anything else? Anything else comes to mind to any of you? What about what's happening to her? She's split. So she's not being treated as a whole person. She's split, and she probably feels very split, because most of the time we think, well, the health professional, the doctor, the midwife, they should know. They're the expert. But then all the decision making should come down to a well-informed mother deciding what she wants to do. Anything else that comes to mind when you see the image? She looks distressed. She doesn't exactly look over the moon about what's going on. So those are the words that came to my mind when I saw this image. Also the hands at the vagina, pressing, separating, pulling apart. I know that you all saw that, but you may not have wanted to comment on it. but it is a significant part of the image, and that's why the artist drew it that way. It is somewhat oppressive, and like you said, too many hands, too many gloved hands, speaks to medicalization. She's flat on her back, you know. So I just want to read out what was stated by the International Federation of Gynecology and Obstetrics. So recent evidence indicates that disrespectful, abusive, coercive service delivery by skilled providers, people like myself, in facilities, hospitals, birthplaces, which results in actual or perceived poor quality of care, is directly and indirectly associated with adverse maternal and newborn outcomes. There's a bit of a hefty statement there. I don't think I need to explain it too much, but the way that women are treated universally across the world, not women, some birthing persons and women are treated, actually affects the outcome. So the maternal outcome, newborn and mother, especially the mother, it has a very negative effect on the experience and on the birth itself and on her health or well-being. That's fine. That's fine. So why is respect for maternity care important? Well, according to the 2014 White Ribbon Alliance, this is from the United Nations, Universal Rights of Childbearing Women, pregnancy and childbirth are momentous events in the lives of women and families, and is an important rite of passage. Now, to me, I feel so upset that we even need to state that. Of course, it's a momentous event. Of course, it's a rite of passage. But we do need to state it because it's not always treated that way. And it has huge personal and cultural significance, the birth of a baby. Because motherhood is specific to women, birthing persons, issues of gender equity and gender violence are at the core of maternity care. So if we have women who are saying they're being mistreated and abused or treated in a disrespectful manner, undignified manner, that is pretty much a form of gender-based violence. Safe motherhood must go beyond the prevention of death or injury and include respect for women's basic human rights. We need a human rights-based approach. Because most of the time in countries we say, well, you know, the mortality rates are low and the morbidity rates are low, and you know, but then when you speak to the women and the people giving birth, they're saying, well, you know, I had an awful time. This involves respect for women's autonomy, dignity, feelings, choices, and preferences, including companionship during care. And the companionship during care is one of our organization's, it's one thing that we feel strongly about, because especially in Barbados, we do hear some women still telling us that they are separated from their loved ones when they're in labor and they're on their own. So the daddy or the mother or the auntie or whoever is left in the waiting room or asked to leave and then not asked to come back to the mother for hours and hours sometimes, which means she's on her own. And, you know, these are things that we speak to when we speak about respect for maternity care. So women's experiences with caregivers at this time when they're having a baby have potential to empower and comfort or to inflict lasting damage and emotional trauma. And this is what we're seeing these days, adding or detracting from women's confidence and self-esteem. We want to make sure that our birthing persons are feeling confident about how they raise their children from a good experience of delivering their babies. Right, the background and history on the issue. So the fight for women's childbirth rights is a new discussion in Barbados, but it's not so new internationally. On the international scene, we've seen what they call active birth movements. And it's fantastic to know that that's been happening internationally for years and years. It's a little disheartening to know that here in Barbados and across the Caribbean region, it's still only just getting off the ground. But, you know, any time is a good time, really, to make change. So Sustainable Development Goals, I believe goals 3, 5, and 10 are helping nations to place a special focus in an often overlooked area. So focusing on gender equality, health and wellness for all people, and equality as a whole. Women in countries and in Barbados have reported. We will say non-compassionate care in Barbados because we know that saying directly disrespectful may be an affront. So we focus on non-compassionate care, but some would say that their care felt disrespectful. Humiliating, degrading, treatment during pregnancy and birth. So this is something that we're seeing, and it's really come from the White Ribbon Alliance from United Nations. Many studies have been done, and many women, many birth persons have been spoken to about their experiences, and this is what they're saying. Women in recent times have had to fight for their rights, their reproductive rights in pregnancy and birth. So birth activism movements, the one that started in Europe was pretty much in the 1990s. When I was a student, I qualified in 1999, so I've been a midwife for about 20 years now. But just before I started training, they had an active birth movement going on in the UK. It was called Changing Childbirth. And it was really a whole set of people who were saying, this conveyor belt, fragmented, disgusting way of looking after women is got to stop, you know. Always, you know, when it comes to change, it has to come from grassroots. People have to demand the change. And that's what happened. In Brazil, there is a movement going on more recently because they have such high cesarean section rates. I mean, they have a very different culture, though. I mean, in the cesarean section, they're going to be doing a tummy tuck and all sorts of different things in relation to, compared to other countries. But they are, they have a serious birth movement in Brazil and Latin America as well, and the Caribbean region is catching on to that too. So this has led to the uprising of the home birth and birthing center model of care with midwives and doulas. So are you familiar with birthing centers or birthing center? So birthing centers are a space where families can go, usually low risk, women have their babies there, and they receive very respectful maternity care. So birth is treated as normal, it's not a medical procedure. Women are allowed to eat and drink and move around and be in different positions and have their support persons with them right the way through, and they can have as many people as they want. They can have a birthday party if they want to when they're giving birth. There aren't restrictions. It's really about what the woman, the birthing person wants. Okay, so international and sometimes, birthing centers are standalone, which is what Mama Toto is. It stands away from the hospital, and some birthing centers are within the hospital, but they are midwife-led. You don't have an obstetrician, you do not have a doctor on the ward. If you need the doctor, you call the doctor, or that she goes over to the obstetric-led side, okay? All right, so International Conference on Population and Development in Cairo. This is talking about more of the history of respect for maternity care. So there was a huge conference in 1994 looking at women, the human rights of women and girls, particularly in reproductive health. They didn't place a huge focus on maternity issues. It was really all the other inequalities that women and girls would face in reproductive health. And then later on, there was a focus on the quality of care. The term disrespect and abuse in disrespect and abuse during childbirth in facilities, that's DACF. That is coined from the focus that comes. and shows associations between poor quality of care and negative health outcomes. So either death or serious injury, things like depression and postnatal depression, mood disorders after delivery, the usual, the obvious, right? In the year 2000, Latin America and the Caribbean founded, I always found it difficult to pronounce this, Rilekahupan, sorry. But this basically is from, this is an organization founded from Brazil, Latin American countries, and the Caribbean region, when they placed a focus on the disrespect and abuse that was being perpetrated to women and birthing persons giving birth in our region. So it was a conference looking at the humanization of childbirth and what could be done. And that is really promising, because this is back in 2000, and the Caribbean is involved in that. 19 years later, we're still kind of, not quite hearing anything about it, but at least something has started. So maternal mortality in the Dominican Republic, the Miller report in 2003, the Miller study, highlighted the negative association. I just want to read something out to you real quick, which is something from the Miller study, and it really shocked me. And I'm glad that we don't have anything like this in Barbados. So in 2003, Miller et al. Noted paradoxically high rates of maternal mortality in the Dominican Republic. So despite 98% facility delivery by skilled attendants, high literacy rates, well-developed transport systems, in this multidisciplinary, multi-site qualitative assessment, observers found these conditions in the labor ward of the largest referral hospital in the Dominican Republic. Women were not informed of the results of their examinations. Women with complications labored together with those labeled normal in the one brightly lit, noisy ward. Some women were naked. Most were lying on bare plastic mattresses, the one sheet having been soiled with urine, feces, or drenched in amniotic fluid. There was no privacy, no dignity, and no attempt to honor the human and reproductive rights of the laboring woman. This is 2003, Dominican Republic. And so the study demonstrated that disrespect and abuse during childbirth in facilities and poor quality of care and lack of accountability were contributors to preventable mortality, because they had such a high mortality rate going on. 2003. Okay, so you probably can't read this. I thought I'd be able to read it, but I can't from there. So as a result of international organizations coming together to create gold standards, international charters, that kind of thing, I can read out some of the international organizations that came together. WHO, which you're all familiar with, the International Confederation of Midwives, the International Federation of Gynecologists and Obstetricians, UNFPA, which is United Nations Populations Fund, IPA, which is International Pediatrics Association, and WRA, which is White Ribbon Alliance. They came together, and many others too, partners, came together to create a way that nations can follow and adhere to a better standard. So this is actually something that we can be certified for, just like there's something called the Baby Friendly Hospital Initiative, which is about breastfeeding. This is the Mother Baby Family Friendly Unit, or birthing unit, birthing facilities. So there's 12 steps, as you can see. And if we adhere to all of these steps and we apply to the ICI, International Childbirth Initiative, we can be designated as a Mother baby family-friendly birthing facility. Our QEH, our Bayview, the birthing center that Better Birthing and BIM will have, can aspire to this. And this is how change is going to come. So I'll read out a couple of the steps. So the first one. Can you see it well? It's probably a little bit too small. Step 1, provide respect, dignity, and informed choice. That's just basic. Informed choice, meaning that any medical procedure, you are asking the mother if you're explaining it to her and asking her if she would like that or not. You're not just doing something and she's like, well, what is that you're doing? Oh, I'm setting up an IV. Well, what is that for? And what's in it? No, you have to get informed consent, and the mother actually has a right to have what we call informed refusal. So she can decide not to have the drug you're giving or not to experience whatever it is, medical procedure. Treat every woman and newborn with respect and dignity, fully informing and communicating with the woman and her family in decision-making about care for herself and her baby in a culturally safe and sensitive manner. Ensuring her right to informed consent or informed refusal. Step 2, provide free or affordable care with transparency. So no withholding a baby in a hospital or withholding a mother, stopping her from leaving because she can't pay. We don't have those issues in Barbados, but in countries around the world, in Indonesia, they will keep the baby in until that mother pays for her fees, her birth fees. Step 3, routinely provide mother-baby family maternity care. So incorporate value and partnership-based care grounded in evidence-based practice and driven by health needs and expectations. Step 4, offer continuous support. So we mentioned this before. Mothers should always have somebody with them during their labor. If they decide to have their partner or their mum or their doula or all three. Step 5, provide pain relief measures and offer drug-free pain relief measures as well as first safe options. Now, this is something we see at our hospital, our main hospital. We really do note that women are offered pethidine and opiate drugs very quickly. But we should be trying to offer other methods of pain relief that don't affect the mother and don't affect the baby in an adverse way before we then go on to give them drugs to manage their birth. Some of these options would be breathing. Deep breathing is one of the most important ways that you can control the level of discomfort that you feel giving birth. Massage, being able to walk around, being able to assume different positions to push in, using a birthing ball. There's so many ways that you can reduce pain and discomfort of birth rather than just offering pharmacological pain relief. A couple of others, avoid harmful practices. I've skipped a couple. Step 7, avoid harmful practices. Avoid potentially harmful procedures that have insufficient evidence of benefit outweighing risk for routine use or frequent use in normal pregnancy and birth. So I'll name some of these, you may be familiar with them. Routine practices that should be avoided. Enemas. Everyone knows what an enema is? So actually making you go to the bathroom to empty your bowels. Sweeping of the membranes, that's where they stimulate contractions by doing an internal exam. It's a little bit of almost like a rough internal exam, and it helps to stimulate contractions, a vaginal exam. Sweeping of the membranes, it's called. Artificial rupture of membranes, that's breaking the waters without due need or cause. Episiotomy, the lady who had done the finger thing, she's gone. So that is snipping or cutting the vaginal opening to expedite delivery. frequent repetitive vaginal exams. These are things that women are subjected to when they go into the hospital at times. Withholding of food and water. This is something that's seen all the time. Withholding of food. They may give you ice chips, but actually withholding food and water is a harmful practice, because how long is a typical first-time labor? Anyone take a guess? 12 to 14, 12 to 18 hours, 12 to 24 hours. That's typical, length of a first-time birth. Second, third, subsequent births tend to be, more quick. But can you imagine not eating for 12, 18 hours and then being expected to push your baby out? And really and truly pushing, labor is like the hardest work you'll ever do physically. Keeping the mother in bed or immobilized. Supine or lithotomy position, which is mother flat on her back, like that first image that we saw with all the hands. Right? Numerous caregivers constantly coming and going in and out of the room. You don't know who that person is. You're, legs akimbo on the bed, and somebody walks into the room. You don't know who it is. Caregiver giving directed pushing, which is telling the mother to hold her breath, take a big breath, hold it. That is directed pushing. That is actually a harmful practice. We see it all the time. Fundal pressure, which is putting the hand above and pressing down when the mother's pushing. That is very painful for a woman, and it's actually very dangerous. It's not something you see in Barbados. I've never seen it, thank God. But it is something that does occur in other places. And immediate cord clamping the cord as soon as the baby is born, and separation of mother and baby for no real reason. So these are harmful practices. Quite a few of them we still see happening in Barbados. We see a lot of these happening worldwide. Okay, so moving on swiftly. So better birthing in BIM. So we are a birth rights movement in Barbados, and our wish is to get those 12 steps and that gold standard adopted right here in Barbados by our hospitals, and we will ourselves be providing that. So we're a registered charity. We have been active since October 2014. We're founded by a group of concerned individuals who really felt passionate about all of this and felt that we need to help bring in some change. We need to spread the word. People need to know about this. If they don't know, then they don't know, right? We represent resistance to the dominant paternalistic system of maternity care that we have at the moment. We recognize the need for families to have more options and more information regarding their pregnancy and birth care. We recognize that a number of our mothers right here in Barbados do experience non-compassionate care. They do. Disrespect and abuse during childbirth. We are developing programs to promote and provide evidence-based gentle birthing practices from a non-profit birthing center. So we will have a space where families, birthing persons can come and experience care that takes them as a whole. We promote and are working towards providing family-centered, woman-centered care, and we are creating a public discourse, public dialogue about birthing rights in Barbados. So I have some categories here, and I'm going to give out, Alice, could you give up? Yeah, the paper is there. I'm going to give you some scenarios, some real life scenarios. So I'd like one of you to decide which scenario you'd like to read out. You can any of you just read out one scenario, and we will see which categories that it belongs in, okay? So these are real life birth scenarios from here in Barbados. Some of them, I think the majority of them are from in Barbados, and the rest are from international, overseas situations that have happened. So we have Bowser and Hill, and they got together these 7 categories of disrespect and abuse. So the first one abuse, which involves hitting, roughly forcing apart the legs of the mother, fundal pressure, the pressing of the top of the belly for normal delivery. We have non-consented care, which is no informed consent for procedures such as when a care provider wants to do an episiotomy, or if they're going to put up an IV, or if they're going to give a drug, not asking for permission. Marital status, language, economic status, educational levels. I would add religious and different or disabled persons as well. Abandonment of care. That's category 6. So facility is closed despite being should be open 24/7, or there's no staff to actually attend the delivery. And the last category is detention in facilities. So not releasing the mother or the baby until the bill is paid. So please have a look at those scenarios. Wonderful. So we will stop there because I know that we're close to time. You may have questions and things like that. But thank you for reading out these scenarios, and thank you for your attention. We have one last slide, I believe. I think it is, you have a question about, shall I? Yeah. So 2 of my favorite poets and feminists. So really and truly, women have stayed silent too long. In Barbados, we may not be too vocal about things, but it's time, talking only amongst themselves about the treatment that they receive. It is time now to start speaking out. Momentum is now gathering as more and more research is done and women are speaking out about the disrespect and the non-compassionate care that they're receiving. Initiatives from collaborating international organizations, we mentioned those already, and the 12 steps will help to bring about the necessary changes. Your silence will not protect you. Let our voices be heard. Thank you.
All right, and I'd like to thank all of you again for attending our S-Files discussion today on gentle birth options and empowering birth experiences. And I'd also like you to help me thank Andrea Jordan for sharing her expertise and knowledge. I think I was really excited today. I really, really enjoyed this discussion. And, just thank you for taking, time out to come and share with us. Yes. And, I'm really hoping that we look forward to hearing about the new birthing center. And, if we can play a part in supporting the advocacy and promotion, certainly on board. And thanks again, everybody.